Hello, welcome to our live COVID treatment option live show. I'm so excited. If you are watching and you're dealing with long COVID or long hauler syndrome, I'm going to share with you over 7 innovative therapeutic treatment options that you can deploy today in your life. I'm also going to be covering home treatments, self-care techniques, as well as nutritional advancements that might be a resource for you on your path to recovery. I'm very excited to join all of you live because at the end of our show, I'll be answering an assortment of your questions. So make sure you comment in the comment box below. And I'm going to be sharing with you some new research, literally research that just came out this week that could be very life-changing for many of you. So let's dig right on into our show. We're going to be talking about long haul COVID, which is a newer type of diagnosis that we are seeing. It's more common in women and older patients, and we're seeing an assortment of factors leading to this diagnosis. So it's very common for individuals who may experience type 2 diabetes before the infection to have greater post-COVID or post-infection syndrome-like symptoms. We also experience individuals that are having reactivation. So the activation of Epstein-Barr virus, that is nuancy. And if you guys want video content about that, I'd be happy to share down the road. But just know that if you've had any type of exposure to Epstein-Barr virus, the likelihood is greater that you'll have a reinfection, that the virus triggers an infection. And then depending on your viral load, so that's one of the newer studies that they're showing is that potentially your viral load was greater in the beginning of the infection, and that has led to this dysregulation of your immune system. And then also we're seeing an autoantibody type of impact. So there's some autoimmunity that is getting kicked up. And this is what I want to share with you. No one single treatment resource is going to fit everyone. And we are all in this category uniquely as clinicians. And I am inspired by my virtual appointments. That's actually why we are covering this topic today, because when I'm talking one-on-one with patients, I'm hearing a lot of frustration. I'm hearing some similar symptoms. I'm hearing some unique kind of nuances that just do not across the board fit everybody. But I am going to share with you some great techniques that I'm finding helpful, as well as patients that are finding helpful. So I'm very excited to make sure that we cover all of your questions, and I see lots of comments coming through. So make sure you ask your questions in the comment box below. But I want to share with you one of the reasons why long COVID is problematic and overwhelming to the individual body is that our ACE receptivity is targeting all of these key organs between our heart, our blood vessels, our liver, and our essentially every organ that is really, really a key part of our functionality and our detoxification process. It's getting hit hard. And the ACE receptivity is where we see an exorbitant amount of symptoms. And I'm going to share with you, actually right there, this is a list, and this was taken by a more recent study, and I can share with you where it's from if you want the link. It's a source from this summer. It's an Indiana University school survey symptom report. They surveyed thousands of long haulers, and the big navy boxes are the greater quantity of symptoms they're experiencing. So as you can see, this is a very big bubble of assorted symptoms. And I am seeing very common trends with a lot of my patients. And actually, many of you who watched my first video about a month ago, how to treat long COVID syndrome, that, and also, by the way, there will be a playlist down in the description box below where you can grab and watch that specific video. These are long-term effects and symptoms that are more common or more frequent in a long haul, long COVID situation. So hair loss, dizziness, fatigue, the brain fog is really, really common, massive headaches. Difficulty breathing is a big one, all sorts of breathing distress, and we can talk a little bit more about that. Even depression and anxiety. Anxiety is really, really big. I'm seeing lots and lots of individuals who are experiencing a lot of anxiety and just have noticed that they're just not how they, their functionality is not the same. So I really am hoping to provide some really good resources here. And this also coincides with more recent resource I have, which is my long COVID protocol. And that's a free access point for any individual who is watching here. We are live on Facebook and YouTube today, as well as anybody on the replay. The link is available for this protocol resource. And this is a very comprehensive program that you can delve deeper into and watch one of the videos where I dig into those more specifically. And it's a 10% off if you click on the link down below. But what I really want to talk about is the greater impact and why this factors into the therapeutics. So when you're trying to treat long COVID, we have to recognize that there is a neuro-COVID impact. And the most common symptom for neuro-COVID, and that's like phase 1, there's 3 phases of neuro-COVID. Phase 1, level 1 of neuro-COVID is the experience of a loss of taste and smell. And by the way, hit the share button for all of you live. I'd love for us to invite all of your friends and family that might be dealing with COVID, long COVID, or long hauler syndrome. I feel like everybody really needs to hear this information because the stats are overwhelming. There are more than 30% of every COVID case is experiencing some degree of symptoms more than 4 weeks after infection. But the neuro state, our brain is really the core factor here with a lot of the symptoms that we're seeing. And we're actually, let me see. Oh, it asked me. Hi. We are seeing individuals. Let me see. Turn this a little bit. Here we go. Hi. Yeah, there we are. Okay. I'm still playing around with my little factors here. Okay. So one of the things that we're seeing is massive amount of neuron damage. And what that means is nerve impairment. So let me share with you, there's a process of nerve or neuron health. And so this top image that is right here, right there. That is, the first one is what a healthy neuron looks like. And what we're seeing in cases of long COVID is that the neurons are actually getting damaged. And there are ways to heal, and I'll share with you, we can repair and heal this process. That's what I cover in my treating long COVID syndrome case or particular video from a few weeks ago. But basically, we need to heal our brain. We're seeing a massive amount of brain-related inflammation, and there are biomarkers for that. I'm excited. I'm going to be sharing a free download today, my long COVID testing checklist. There'll be a link down below for that as well. But there are testing mechanisms for us to see just how impacted our brain is. And if we look at this ACE receptivity, not only is the brain targeted, but look at all those other organs that are going to be inflamed and dealing with massive amounts of inflammation. So when we're looking at healing, we need to look at some innovative treatments. And that basically means that we are all, as clinicians, in a novel state of post-syndrome, post-infection healing. And it requires a certain amount of grace from patients with us because we're all trying to figure out the best way to provide individual resources. But I'm going to share with you 7 of some of the resources that are in clinical clinical research. We're researching this in an assortment of medical facilities, and I'll list them as well. You might actually live in a town where you can get access to that. And also for you to maybe even share this video with your clinician, because we are also overwhelmed with a lot of information and a lot of research. And so this is just a clearinghouse to give you these 7 innovative therapies. The first thing that we're seeing is low dose naltrexone. This is commonly used for chronic fatigue, really, really intense chronic fatigue syndrome in low dose form. This could be 0.5 milligram, 1 milligram to start off with, titrating up to 4 or 5 milligram doses to ultimately lower and control the inflammatory levels. And that's a really, really big therapeutic that we're seeing. Now, another therapeutic that we're seeing are beta blockers. There are patients that are dealing with a lot of heart-related imbalances, elevated heart rates, higher blood pressure, weird diastolic changes and systolic changes. And what a lot of clinicians, particularly cardiologists, are seeing in the functional cardiology is that using a beta blocker, not necessarily 100 milligrams, for some patients can be extremely, extremely helpful in managing that symptom. And for some patients, they see resolution over a period of time. It just depends on how many infections have you had. What I have noticed in my own caseload of patients is that a recurrence, where if they had one infection, the symptoms of long COVID are milder. But if they have two or three, which is common for many folks, then they might have more intense need for therapeutics, as well as some of the complementary symptoms that go with long COVID. Another treatment is something called intermittent hyperoxic hyperoxic treatment. And basically what it means is using oxygen at a very low rate, like 20%, or not 20%, it's a 12% oxygen titration to mirror what we call altitude training. It is breathing in low dose oxygen that has a protective effect through creating cellular adaptation within your body. So the idea is that when folks hike, and by the way, I have done this and I have experienced high altitude acclimatization. What is it? Where you acclimatize at higher altitude. And folks that get into that higher altitude, it is a slow, gradual lessening of oxygen levels. What they're seeing is that actually triggers the body to be more adaptive, meaning to be better utilizing oxygen, thereby supporting and enhancing some of those organs that might have been starved for oxygen in some of those cases of folks being on ventilators. Now, another therapeutic that is pretty amazing is, here we are again, hello. We are noticing that individuals using a sodium pyruvate nasal spray, this is a very powerful way of addressing some of that inflammatory state in that oral and ear, nose, and throat passageway. So for instance, this is another solution for folks that have experiences with the loss of taste and smell. Now, another one that I love is hyperbaric chambers. This is an actual chamber. This is what it looks like inside when folks are in there. And basically, hyperbaric chamber therapy is like scuba diving, if you will. So it's a kind of process where you kind of go, there's a reduction in pressure and it's slow and steady. And then you get to that kind of lower state and then you slowly go up. It does have a controlled mechanism, and I'll share with you what more of these devices look like. And we see this in a hospital setting where we are seeing this specifically in certain medical facilities that are running these labs. Other hyperbaric chambers will actually have like this type of seating where people go in, they read a book, there's a clock, they'll go in for 45 minutes. And there are some health spas that are engaging in this as a therapy. So these are resources that you might have in your backyard. Now, another thing that has been amazing, and this just is hot off the presses, and you guys know I've talked about melatonin a lot, and I'll make sure to add that link down below. But melatonin is a treatment option, not just for COVID. And this has been, this just came out, this research this week. I want to say it was on the 22nd. Let's see. It is the 20th of February. And it talks about using it both as a treatment for COVID, but also there are ramifications in the long haul world. So this is really exciting because melatonin in the 3 to 5 milligram dosage can be highly beneficial, evenly spaced throughout your day, and sometimes titrating up depending on your current state. So you can test your melatonin. I do testing here with my, actually I'll show you. These are the kind of test kits that we run here. I'll make sure to post this down below after these videos are posted. But you can test your melatonin. Melatonin is actually a neurotransmitter. Every single cell in your body has receptivity and will utilize melatonin. And as we are learning more about the uses of melatonin, we know that it has a direct correlation to our pineal gland. It helps us keep up our anti-aging processes. So when we're looking at the impact of long COVID and cellular oxidation and oxidative stress, it makes sense and leads to where melatonin is coming into being a powerful resource. Now, I do want to mention for all of you watching today, make sure you hit that share button, especially on Facebook if you're joining us live there, and on YouTube, comment away. I'll be answering a lot of comments. I'm seeing all of them now. But I'm excited because these are therapies that are readily accessible in an assortment of resources. Some of them you can actually deploy at home, and we'll get into that further. One particular therapy I've highlighted more recently is heat therapy. And currently there is a specific UMass Amherst. They are putting people in these like scuba suits and running really intense warm water. And it is this process of heat therapy, and it's the circulatory effect that they're utilizing. Now, there are a lot of ways we can tap into that at home, and I'm going to share some of that with you coming up. But that is something just to know, that a lot of these therapies, like UC San Diego is doing the hyperbaric chamber and oxygen therapies, which is pretty exciting. Now, I'm going to dig into some things that you can do at home, because this is really the critical piece. Your control of being able to be at home. And obviously, many of you are debilitated or feeling like you can't even get the energy up to get out and about. So I'm very aware of that with my patients. Because I work virtually, I'm aware of how they're feeling and even how we are conducting our appointment. So I want to share with you first something that is very interesting. This is a research piece that came out. Let's see, the date is it was received in November 13th. It was released and accepted on the 24th of December. And this is in the Metabolism Open. This is an extensive piece of research that digs into fasting. And I've had a lot of conversation and thoughts about fasting over the years here on YouTube. And many of you know I'm actually doing my own fasting as I prepare for our wedding, and just trying to get over the last year of flux in our life. But I want to share with folks that extended fasting is highly powerful. There's this 5-step, 5-part process to fasting that is detailed here in this little app that I use on my phone when I fast. It's called Life. It's very powerful. But you can see the different pieces of fasting. We kind of go into the little fireball is the beginning of ketosis. That's where our body starts to turn and adapt metabolically to how we're burning fuel and using energy. And it ends up turning to fat. We have ketosis, this fat burn. Then we get into this massive, intense ketosis, and that triggers something called autophagy. So autophagy is this new scientifically researched and found in 2016 body process. Before 2016, we didn't really know a whole lot about autophagy. And in fact, the research in 2016 won a Nobel Prize for this research. Autophagy simply means our cells are recycling. We can actually have a reduction and a complete apoptosis of cells that are dead, that are not functioning well. So we can get rid of them. We can just break off certain cells that are dysfunctional, and we begin to have this what we kind of see, this protein restructuring of our cells. There's a lot of neuro studies, and that's why this is really great, because Neuro-COVID, we can parlay a lot of the information we know about Alzheimer's and neurodegeneration. We can parlay that with the long COVID. So going back to my little fasting guide here is the little recycle symbol is autophagy. Then we get to a point where the little strong arm, that is usually within 2 days. 2.5 days, we start to get a mass production of human growth hormone. So we start to, the autophagy is the cell shedding. Human growth hormone elicits the new growth, the new cellular growth. And then we go into the lowest levels of insulin that our body is producing. And that actually affords these new cells that are getting manufactured safety, and it helps them bond and helps them to take root without the influence of insulin. The insulin changes is a massive metabolic benefit. I'll talk a little bit further about that in other content, but when it comes to long COVID, This is the point, the last part. It looks like little pieces on here, but the last point is where we can really, really tap into an amazing power that extended fasting. And it's not intermittent fasting. We cannot get to these levels with intermittent fasting, even though this research shows, this research is what we see with intermittent fasting specifically, but it digs into those edges of extended fasting. I just finished an extended fast yesterday morning. I did my longest one of 4.5 days. And this was me. I took that yesterday towards the end, and I really did. I felt awesome on day 4 and yesterday morning. But there's a part in the last day and a half of this fast for me. So by day 3, you start to get into what is called immune cell recycling. And that is really potentially beneficial for a long hauler, a long COVID syndrome case, because the immune cells are just gone awry. We have the cytokine storm, and we have a lot of negative impact on the immune system. And how all of this or this extended fasting works, very similar to intermittent fasting. This is one of my readings. And don't be surprised, low glucose levels are common, especially for women. And for women, particularly when we see high ketones. I was pulling 3.4 ketones, which is pretty great when it comes to this index, but we measure kind of the ketosis that people achieve, the fat burn, if you will, and this whole cell recycling is you're going to be measuring your glucose and you're going to be measuring your ketones. And that is what allows us to get the GKI, which is the glucose ketone index. And it sets, there are different levels. They're mild, moderate, and more therapeutic, and then highest therapeutic. Like I can easily go into that kind of medically enhanced therapeutic process. My body is very well adapted to that. But that is a really, really wonderful treatment option for long haulers and long COVID patients. Another wonderful therapeutic is the Solo Pad from Sunlight. And this is a far infrared unit. And so going back to heat therapy and at-home treatments, we are now being able to see far infrared therapy being highly beneficial in heating up and elevating the body, triggering an immune response, a healthy immune response, meaning it starts to trigger reduction of toxic cells. We get cellular apoptosis with far infrared. We have a lot of wonderful benefits. I recently had a discussion here on YouTube about far infrared in prostate health. But I'm going to share with you here a video of me doing far infrared. This is my solo unit. There are many different ways to use this, and I'm going to share with you. I have 3 different forms, many different price points, and links are down below. This pad, there's 2 parts to the Solo Pad, and it'll be hard to see on the video, but there's a bottom pad that emits far infrared, and I'm laying on it, and then the dome is emitting far infrared. So the dome pulls right up to about below my neck. There's this little cloth kind of shield there. It's bamboo, and it's very absorbent of the sweat, but check this out.
I want to do a quick little video break here, and I'm about 15 minutes in and sweating profusely. It is like dripping down my face, my arms. I can feel it dripping down my torso. It's amazing, great detoxing.
So that is an example of me doing a far infrared sweat. You can get up to very high levels. And what's great is this particular unit has numbers. You can kind of go up to 9 on both the lower and upper parts. And you can do this for 10 minutes is what you can tolerate, or up to 40 minutes. There are also, you see Gabriel, we have also unit where it has a chair. So if I need to watch TV, or I need to do something and I need my hands and I've got to, work while I'm doing it, I can sit in this as a zip up far infrared unit. Your head sticks out and you have hands free. And this is a Therasage unit that is really wonderful. And you can't see it, but the little zippers, the hands, you can stick your hands out, and there's a little pocket you can have your cell phone, and then the little component that powers it up. Now, here are some other options. There is this really wonderful brand on Amazon. It's called UTK, and they have a jade and tourmaline. Those are little stones on their far infrared mat. And there are small sizes. there are medium sizes, and there are whole mats that people can use. And you can even, position this in a chair. For some of my long haulers, they're experiencing pain in different parts of their body. And so that is something that I just want to highlight, that there will be changes also in this progression. And so you can use far infrared to reduce pain. It can reduce swelling and inflammation. It's very powerful. And far infrared is not like a sauna treatment or a sweat at like your local gym where they have those, kind of dry saunas. Far infrared is a particular type of light wave that goes anywhere from 2 to 3 inches into the skin and past the dermal layer, and can actually heat up and invigorate the lymphatics and help heal organs and tissues and our joints that are dealing with a lot of inflammation. So I really, really love that as an option. And I've got links down below where you can check that out. Now, nutrition is something I want to talk about, because what you are eating is going to really help impact your everyday experience with food as healing medicinal properties. And food is very much medicinally oriented. We just have to know the best way to kind of tap into that. And I've always been a fan of green juicing. As you can see here, I love to use dark green leafy veggies and combine really good antioxidant. Really eating the rainbow is one of my favorite things to recommend, but really focusing in on an anti-inflammatory diet. And that includes reducing gluten, reducing dairy. And when I say reducing, like complete elimination, no dairy, no gluten, eliminating any harmful chemically laden animal proteins, consuming healthy fats, very anti-inflammatory or anti-inflammatory fats, which are going to be less seed oriented and more fats like coconut oil. I do love ghee in this category because it has a lot of nutrients. And that takes me into the keto diet can be very, very beneficial for a lot of patients. But my caveat with keto is avoid the dairy. And that can overall help benefit your body. Now I'm going to share with you something else that's beneficial. It is consuming collagen. So collagen has a really, really important role in helping repair and restore our neurons and the overall tissue of our body. So I want to put up this one image here. And so I'll probably go out of view again. Okay. So if you see that bottom, right there. So this little neuron, these are damaged neurons. If you're dealing with long COVID, you have damaged neurons, and these damaged neurons, it's kind of like Gabriel had these little toys when he was a little bit younger, and they're like Legos, but then kind of a string. Well, those in our neurons, they've just kind of broken open. And so what we need is restorative structure to help repair that. And what I find that promotes the healing, so see, we get this kind of healing process, collagen can greatly enhance that. And each person's experience with collagen is going to depend on a lot of factors, like how much inflammation are they dealing with? And collagen comes in powder form. One of my favorite collagens, oops, here we are. Hello. Collagen is organics. I work very closely with them. I do a lot of education with their patient community. I am partnered with them, so just FYI. But one of the things that is really great is that you want to not just get a collagen type 1 or collagen type 3, but you want 5. There are actually 26, 28 collagen forms. But what we find is the certain ones like collagen 1 and 3 are synergistic, and other collagens like 5 and 10 are synergistic. And when we're looking at restoring our muscle tissue, our joint tissue, when we think about our muscle tissue, those are also some organ tissue. So if we've had heart damage, lung damage, we're having fibrosis within the lungs or breathing challenges, or we're having microclotting, there will be scarring, and we need collagen to help that repair process. So the organics version gives us collagen type 1, 1, 2, 3, yes, 1, 2, 3, 5, and 10. And I really love that as a resource, and I use it in my coffee. Sometimes if I'm drinking coffee, I put it in my smoothies, I put it in my yogurt. I actually consume collagen more frequently than just one time a day, because it's not only great as the kind of aesthetic anti-aging, reduce your wrinkles, but it is highly, highly beneficial for enhancing your overall wellness. And so I really love to recommend that for a lot of my long haulers. And, just to kind of reiterate, and there is a link down below, one of the things that I did in a video previous, about a month ago, I put together this free access long haulers COVID recovery protocol. And part of this ties into self-care. And so it really becomes important that you zero in on clearing time out in your day to deploy a lot of soothing, stress reducing, anti-inflammatory, enhancing activities in your day. That could be things that make you happy. If dancing to music or reels or whatever makes you happy, do that. If watching birds does that, going out for walks, doing yoga, there are a lot of great free resources and a lot of therapeutic resources you can tap into at home. But here are some self-care ideas. I love folks to create a spa day at home where they meditate, they're drinking herbal tea, and they're carving out time for themselves to have space for healing. And some folks, it might be carving out a few hours in the evening, and some folks, it might be a little bit more extensive. But I do want to share that protocol is highly impactful. It's listed down below. And self-care is what we consider the new healthcare. You're ultimately in the driver's seat with long hauler syndrome and long COVID. And don't be surprised if your clinician has no sense in terms of what resources are out there. PCPs are so overwhelmed, and a lot of therapists or clinicians, a lot of physicians and specialists are not up to date with just the amount of research. I mean, in even preparing for this show this week, there are a lot of new information and pieces of research that it's challenging. So just know that you may be seeing providers that are well-intended, but they just might not have been able to go to the latest medical conference and get tapped into what we have going on in the long COVID world. And that also means that they might not know what labs to test or what you should have run, which is why today I'm sharing my long COVID testing checklist. This is a two-parter. This includes, on this side, this is the good stuff that you can actually print out and take with you to your clinician's office and say, I want to make sure I have these biomarkers run. They are highly effective tests that evaluate immune subsets in your blood. They also, again, this is linked down below, so you can grab this down below. But they will evaluate your autoimmune T cell responses. They can evaluate cytokine impact within your body. The cytokine is basically an inflammatory storm that is occurring. They can also measure certain anti-inflammatory markers that kind of keep things in check. So if things are too high, it means something else is going on. But labs for COVID are really important. And I really hope the takeaway today is to really push for lab work. And I hope you check out that testing guide down below. So I do want to make sure and highlight our question of the day. I always love asking you questions, and I'm curious what concerns you most about long COVID. And I will be taking questions today. Before I do that, I do want to share with you that later this week, if you love this type of content, I am going to be posting my workshop. This is an off-channel workshop. This is a privately held virtual workshop. It's live, and there will be a registration link. My monthly workshops are $24.99, and we're going to be digging into healthy gut and a happier you, how to ultimately heal your gut. That's really big with long haulers because, let me go back up to this one image so you can see, the digestive process gets really, really rocked with this. And I have actually a really good friend who has had 2 COVID infections and is dealing with really, really intense nausea from her bout with long haulers. And I will tell you that the digestive tract really, really gets imbalanced. Our microbiome takes a big hit. So my workshop that I'll be posting later this week. So if you haven't followed me here on YouTube or over on Facebook, make sure you hit that follow button. And so when I post that link, I believe we are probably going to have a little bit of a limited quantity of participants, but I'll highlight that in the future. But I just really want to now take your questions. So comment down below. Let me know what questions or concerns you have about long COVID. I'm going to head over to my screen here and answer specific questions. And I love I see Michael and Monica and Veronica and Scott. Hey, Scott. Okay, so Rebecca says we had COVID we had COVID back in July. My husband still can't smell or taste help. Okay, so that is very common. And I am going to give a link here in the description box where you can grab a guide. And by the way, there are links down below. I have a whole, so Rebecca, there's a link in the chat box. In the description box, I have a playlist on YouTube specifically about how to restore your loss of taste and smell. So that would be where I'd recommend you check out. Hey, Michael. Hey, Misa. Let's see. Okay, so, or Militia full. I had it in December. I still get a little tired and have a weird pain in my right arm. Yeah, weird random pains, random feelings of tingliness. That's neuro. That is a neuro impact. So those neurons that I was highlighting that have gotten broken and impaired because of the infection, that is a reason why we see that. Joel says treating the virus-induced endothelial dysfunction in the key. Oh, treating the virus-induced endothelial dysfunction is the key, absolutely. And basically the endothelial dysfunction, we are noticing that these certain protective barriers to our mucous membrane are getting completely obliterated. Part of it is because there is ACE2 receptivity. So ACE2 receptivity has a huge role to play in also the recovery. Scott says, thanks for sharing this important information. You're welcome. It's so good to see you today. I hope you're well. Scott's detailed for a lot of our community. He's been dealing with COVID, and I hope you are feeling better. Betty said, I had COVID 3 times, 2019, 2020, 2021. My worst was 2019, before, but I got it before it was announced. Yeah, I've seen that a lot with patients. And she has a reference for extended fasting. She said she did the fasting for almost 5 days, and I have been feeling so much better. Yay. Extended fasting, let me know, comment down below if you want me to talk about that. I am loving it. You know, I am a mom and I'm really zeroed in on trying to be at my healthiest state, as I think all of us want to be optimized as individuals. And so, you know, biohacking is kind of the newest advancements of healing. And that's where this extended fasting is coming into play. Pretty soon, there will be some research I'm going to share with all of you. It isn't fully published yet. It's not me, but there's the guru of fasting. I went to my first medical conference in over 2.5 years in December. It was in Vegas. It's the anti-aging medicine conference. And this doctor, Dr. Longo, has done extended fasting research. And what's awesome is we have really wonderful results and benefits beyond just disease management, but people feeling fantastic and improving depression and anxiety and getting off of medications. But I believe that there's a place for that in the long COVID community. Louise Browning, why does my severe fatigue come and go? I've been diagnosed with long COVID/ME by my consultant in the UK, as he is 90% sure I have contracted COVID in December 2019. The fatigue can last for weeks to months, and you can have up and downs. So this is what I'd recommend, Louise. Grab this long COVID testing checklist. This is a free download. I just need your email so I can email it to you. That email, once you get it inside the email, there's several links to grab the download. So please check this out because I highlight the labs to have run for Epstein-Barr, and that Epstein-Barr reactivation, there are certain biomarkers that we can evaluate in the blood to see. And in many cases, and I have been an Epstein-Barr viral victim, it can take you down. And we are seeing where people feel fine 1 week and they're doing their daily life, and then it comes back and it's like this chronic fatigue syndrome. And what I find and feel like as a therapist working with folks individually, I feel like we're probably going to see some new diagnoses related to this autoimmune effect where the body's kind of attacking itself in kind of crazy ways. And so there is a lot of research, but it's novel. And so we don't know. And that's really key, is just knowing we're all in the same boat and we're trying to figure out ways to therapeutically aid all of you. So on the fridge, what about FIR sauna? So far infrared, that's what I'm talking about. Those are the 3 things that I highlighted. And maybe I got to that before you asked that question. And Nay's Corner, is fasting good for anyone? Yes, fasting is awesome. So I'll just say this. If you want to improve your longevity, you want to turn over cells that might end up being precancerous or turn into cancerous cells, highly beneficial for that. If you want to enhance your natural human growth hormone production, check, it will do that. It is highly, highly beneficial for also helping your body become more adaptable to metabolic changes. And so metabolic adaptation is what we're going after with the extended fasting. In some ways, we get that with intermittent fasting on a day-to-day basis doing keto, but real true metabolic reset is going to happen at that extended fasting level. And that's actually what the research is coming out to show, even with hormone imbalances, because at the end of the day, insulin and cortisol, and they're paired up. They go hand in hand, as well as liver function in the state of your hormones, thyroid included, female reproductive hormones. Says, so I was long COVID. So I was told long COVID is actually Epstein-Barr virus reactivated with COVID. So these protocols help that too. So I will tell you, not in every case. So that's the one thing we have had some research, but it's not overly extensive. And so it's not as simplistic as just saying, oh, it's just Epstein-Barr virus reactivated. We are seeing some studies showing that there is still dead viral particulates that the individual's immune system is trying to attack. And so going back to, and I'll post this up here. So going back to the benefits of far infrared, actually I spelled that wrong, so I apologize. The benefits of far infrared, so there should be an R after the F. That is, let me show this up again. So it promotes detoxification. We get cancer cell apoptosis. It oxygenates your cells. It's anti-aging, and it is anti-inflammatory. So grabbing resources like the sunlightened sauna is fantastic. Grabbing a seated zip up sauna unit like this from TheraMassage, far infrared products is wonderful. Kind of depends on what you want. The smaller versions like the UTK in different sizes, I have listed down below for my Amazon or for my YouTube folks. I'll be adding that to Facebook as well. But that's something you can grab very easily and have, start utilizing. So I prefer the more in-depth unit like the Sunlighten Solo Pad, where I showed you that video. I really am a huge proponent of that as a resource, as a therapeutic. I just feel like you're getting far infrared right on your skin. And that's so powerful. And so you sit on it, and I actually will, sometimes it's mobile. You can put the pad on your bed. I don't always use the dome, but you can put the pad and the dome on your bed. It's highly adaptable. It's portable. You can smush it up and fold up the little pad, and it can be stored away very easily. But they're not inexpensive units. So that is just one thing to notate for a lot of viewers interested. It is an investment, but I use my pad, especially now it's freezing. I use it all the time. I love it. Like I'll put my little pad on the bed. I'll throw my sheets over it. And then, I might read or kind of meditate before bedtime, and I'm doing my far infrared, and it's awesome. I love it. And I've had my unit for a while. We had treatments like this in my spa facility. I never had far infrared until really the beginning of COVID. And then I had to close up my in-person. So I never really had the ability to offer it as a service. And so I use it all the time. I see somebody said, Melissa, oh, look, I can show your comments. Oh my gosh, that's a new function I didn't realize. So Miss Alicia Full, sorry, said, I just started taking collagen today. Yeah, collagen is awesome. And so Kit asks, what is long COVID? So long COVID is basically now a recognized post-infection syndrome that has an assortment of symptoms. And I'll share with you the symptoms that we see most highly impacted, where people have severe headaches, they have sleep imbalances or really intense sleep imbalances. They're just overly fatigued. massive amounts of anxiety. Hair loss is a huge one. Most notably is the kind of impact with the loss of taste and smell. Even folks on the more kind of intense state, and I'll take down your comments so people can see. Rarer but common symptoms are folks that are going to have some sort of heart inflammation. That's where I'm seeing the beta blockers working, and folks actually having, unfortunately, an experience of almost like a POTS syndrome, where they have these weird changes in heart rate. Even arrhythmia, heart arrhythmia is cropping up. I've got folks with scarring in their lungs, and then type 2 diabetes, even kids, we're seeing kids, which is crazy. So there are a lot of specific challenges that people experience. And so it is not a made up syndrome. When people say they're tired, they're fatigued, they can't get up out of bed, they are it's legit. They are not fabricating. They're not over exaggerating. They literally have their body still in this attack mode. And what we're seeing is a massive amount of brain related inflammation. And that's why I've got this checklist here. This is how you can help. If you have a clinician who is not in total belief that your symptoms are real, which, by the way, fire them and find a new one. There are many of us who are actively engaged in helping support the COVID community and the long hauler community. It is it's just terrible when I hear that happening. But the checklist and the tests can be helpful, and also zeroing in on what inflammation exists and where might it be. So that's really important. So, and Kit said she hadn't heard the term before, and that's common, but it is, you're going to hear more of it. At minimum 30% of all COVID cases are long COVID. Okay. So Louise, hey, Louise Browning, she says, Betty, Alanese, it's scary that these symptoms seem to be getting worse and not better, even after 2 years. And I'm sorry, Louise. And that is something where we have to go into the real intense therapies to get control. And I hope, Louise, if you haven't had testing, grab that test and let's get you tested so you can see how you're doing. The other thing I want to highlight, let's see, Nay's Corner. Hey, Nay, what brand of collagen? So it is linked down below in the description box in YouTube, and it is organics, their clean source collagen. That is what I recommend. I don't recommend any of the other collagens because they're not always clean sourced, and you might be getting a lot of excess hormones because they're animal based. That's really key. Let's see, Marsha Davis. She says, I never feel good anymore. I think that's where I had COVID. It's been almost a year. I seem to be tired all the time. I know. I feel you. I'm hearing you. GK, hi, Dr. Melissa. I'm still having issues with deep breathing. The pulmonologist said it's inflammation of my airways. What else do you recommend for that? So I'm going to go over and share with you. My recommendation is to grab my long COVID protocol. So that is listed down below. And it is highly, highly beneficial at zeroing in on the way of reducing inflammation. So we need to go deep cellular-based inflammation, anti-inflammatory in its properties. And if you haven't watched my first long COVID video, I delve further into that here, the treating long COVID syndrome. And there is a playlist here on YouTube where you can watch that and gain a little bit more information about kind of the philosophies of my treatment protocol. I really zero in on how I'm treating patients, and I'm actively seeing patients. So if you want to book an appointment, you can go to my website. I'll actually post that down below so you guys have that. I forgot to do that for you. So Natural Health Resource. So I'll tell you my website. It's listed in the comments for us live, but it's also in all of you can get that through Facebook and YouTube, but go to my website, www.naturalhealthresources.com, and you can schedule and book with me directly. And Kit says, do I know if grass-fed colostrum is good? Absolutely. And that's actually where I'm going to be digging more into colostrum in my private workshop that I'm hosting, my healthy gut workshop, specifically the Healthy Gut, Happier You. We're going to talk about all the different ways of healing the gut. And so colostrum therapy I'm a colostrum therapist, and I'll be digging a lot into that. So Marcia, I don't know if you saw the original symptoms, but I had posted that earlier in terms of symptoms of COVID or long haul COVID. Naomi over on Facebook. Hey, Naomi, is there anything you can do about the random pain, please? So I also love to utilize specifically CBD therapy. And so I'm going to share with you one of my favorite CBD vendors. And let me I'll post a link here. There is a wonderful resource where individuals can tap into CBD therapy. And sad part is it's really hard for me to talk a lot about that on YouTube. So I didn't include it in this presentation, but I'm going to post a link down below where you can gain access. And I actually have a coupon code. It's Melissa. CBD. All right. So that equals, I'm going to say use code Melissa and then CBD for 20% off. Okay. So check in the chat comments down below for that. But pain management, topical pain relievers like with CBD, and also the far infrared. Far infrared is seriously, it's one of the most powerful resources. And also it cuts out having to get a massage, because that's just temporary. We need stuff to drive in and be anti-inflammatory, and far infrared does that. Okay, so now Starry Night, Tracy M, hello. I like the little emoji after M. Says, hello, I've had long COVID since December. My doctors gave me an inhaler, sending me to physical therapy and signing me up to a long COVID clinic. Yes. So the inhaler, I'm wondering, was it the sodium pyruvate, or were you doing any type of saline spray? I'm curious if that was it. But yeah, physical therapy can be helpful, but there's so many other ways. And so definitely check out my protocol. It's free access. All you have to do in my Full Script store is set up an appointment, or not an appointment. All you have to do is set up a free patient account. That's it. So just make sure you sign up with your real name, because if you do order something, it's going to ship to the rando name that you put in. I have seen some patients, sign up and their names are not even true names, but they'll ship it to your address and your mail person might not recognize it. But that can be very, very helpful for that respiratory grief. I will tell you, just from a patient that I've been working with specifically over the last few days. Honey, I'm still going okay, buddy? Okay. Thank you, honey. One of the things that I've seen with a few of my patients, one particularly, was having troubles breathing when he was in the shower. And part of that's just the heat and just that inflammatory state that occurs. And then that produces anxiety because we're gasping for air. And then it's just like this whole process, a cumulative process. I put him on my protocol. There's specifically some items in it that are very helpful for reducing the inflammation. And I dig further into another YouTube video, so you can watch that further, but highly, highly impactful. He literally texted me within 2 days after starting this protocol. He's like, I'm feeling better. Like I'm not experiencing the breathing challenges. So that's awesome. And keep the comments coming on, and please make sure you hit share and like, and make sure you follow me if you haven't. Naomi Miller, what does extended fasting entail, please? So, I plan on doing a specific video about this because it is something I have found, of course, being a female. One of the things that is really interesting about medical research in general, if you didn't know this, we as women tend to be left out of a lot of the human-based studies. And even we'll see in rat studies, fluctuations in the male-female population too. So one of the things with fasting is a lot of the data is based on men. And men's hormones, our metabolic process is different just from men and women. And also our liver function, which is a huge part of fasting, is different. And so that plays into how well women fast and how men fast, and then when women should fast, and all these nuances. So I will be doing that in a future video. Comment or hit that like button if you are interested in watching that, because it's pretty amazing. I have seen some substantial differences in my own body. I think I've been transparent with a lot of folks. Since like my third trimester with Gabriel, I've had really challenging high blood pressure. And those markers are going down, which is great. Okay, Gary. Hey, Gary, it's good to see you. Thanks for watching. 80-year-old male suffering post activity fatigue, brain fog, shortness of breath. Any special treatment for elderly? So one of the things with my protocol, there's no sort of differential in terms of age. I do get very specific when I work with patients one-on-one, and if any of you want to do that, I can work specifically with you. I'm virtual, so scheduling is open, and all we need is this format, and you're on Zoom. You have I record all our appointments and send it to you so you can replay as often as you want. But basically, the protocol really is digging into your inflammatory markers and trying to lower those. It's digging into minimizing the cytokine destruction and regulating the cytokine storm or residual cytokine reactivity that we're seeing. That's all items that you can test for in the long COVID testing checklist. But I also dig into how to speed up your body's free radical kind of Pac-Man eating process so that you can start to see healthier cell turnover. But definitely, Gary, a lot of the items in this video today, you can start to deploy, and I would recommend that. Taylor, hey, Taylor, my daughter had C19 2 weeks ago. She still has heart arrhythmia, residual, and shortness of breath. You recommend NAC, PQQ, and maybe quercetin? Yes, absolutely. All of the above. If you really want some high potency, definitely check out my full script store. We have also for if you're doing PQQ, I would recommend you checking out MitoQ, and that's practitioner only accessible. That is amazing. There's a heart one that I would recommend. But again, this is just informational and not specific medical advice that I'm giving. Monica B, yeah, me too. The doctor gave Montaglucin inhaler. Yeah, it's crazy. Okay, so it's a serious post-anxiety too. So any suggestions for calming that? Yes, there are amazing resources. What I'm going to say, if you haven't done it, definitely make sure you subscribe to my YouTube channel and check out, I have a long COVID playlist. This video that came out probably now almost a month ago is going to greatly dig into all of the different things that you can do. And so that's what I would recommend watching for any of you who might be joining and new and you're not really familiar with my content. I'm a naturopathic physician. And so I really tailor a lot of everything that I do is tailored to each of my patients' needs. And I globally look at long COVID in my patient practice and pull together some of the most powerful resources I'm seeing, employing a lot of change necessary for those more common annoying symptoms like breathing imbalances and anxiety and headaches and fatigue, the brain fog as well. And I'm research-based, as I mentioned. I think I highlighted, 2 research pieces. I'm not pulling my data out of thin air. I'm heavily science-driven. And have always been as a naturopath, even though that might be counterintuitive to some naturopaths that are out there. But it is definitely something that it's really important that if you are suffering, don't suffer alone. And there are treatment options. And that's what I really wanted to provide for today. And Ahsoka, arigato gozaimasu, for watching, for sharing your wealth of information. I appreciate you watching. And we've got more fasting questions. Nate's Corner, is fasting good for all people? Yes. I was told the T3 levels are low. Should I fast? So there's a lot of nuance there. It's hard to determine specifically unless I worked with people to kind of give you an idea. I do like to have our stress levels leveled, the cortisol, before we do any extended fasting. And there's an easing into it, and specifically, I see Justin. Hey, Justin. Hey, let's see. Is the internal heating treatment an exception to the usual avoiding heat to our limbs with lymphedema? So that's an excellent question, because what is amazing with far infrared is that there are settings. And so you don't have to go intense heat, but it does induce sweating, and that will motivate the lymphatic system. So there's an element where the sweat is lymphatic in motivation, and it will elevate the heart rate. And there's a pumping mechanism too. And so we will see that vascular involvement, which helps to support the lymphedema. I don't have my lymphatic patients do extensive, like 40 minutes. I might have them test out at 10 minutes and see how they do. But again, everybody's body and staging of lymphedema varies. But yes, it has massive benefits potentially for you. So the heat it's a different type of heat. And far infrared is not anything like the heat we experience outside. It's not like the heat you experience from a shower. And I actually had somebody try and debate me about that. Like, that's light is, we have a spectrum of light. And so UV's on there, visible light. Far infrared is on the spectrum. And so somebody tried to tell me that water could match that, and that's just not true. Rebecca says, when you fast, you drink water or nothing. So, oh yeah, it's not a dry fast. So I actually have this I've adapted my fast. I'm constantly measuring my glucose and ketones, as I posted before. So I have a little bit of an altered fast. So I do eat a little bit, not anything intense, but I am drinking lots of water. I actually drink a lot. I love this. This is my new LaCroix. I feel like LaCroix, for some reason, when we moved to Texas, they changed the flavor. So I'll drink like 1 or 2 of these, but mostly super enhanced. Super mineral enhanced water is what I go for, and teas like dandelion tea. I'm always drinking dandelion tea. Let's see. Kit says definitely drink water. Yeah. Your body needs water. Your body does not need food for a certain period of time. So there's some sort of equation like per fat pound, it like so many per pound of fat, you're burning X amount of calories when that's transitioning. And there's this whole process, but yes, you need hydration. And so I enter fasting very well hydrated and exit it extremely hydrated. Okay, so let's see. Taylor, my neighbor's son got COVID and then got a type 1 diabetes diagnosis after no previous diabetes. Crazy that this virus can cause that. His mom doesn't believe the virus caused it. Coincidence? No, that is actually there's research out there. And Taylor, so what I would do is you can actually Google if you want to, kind of help guide her to some clinical reality, clinical truth, is that and I have a good friend here in Texas. She's a pediatric endocrinologist and sees us all day. And she's like, it's just insane. The numbers have ticked up. And she's doing rounds in the hospital with kids that are in diabetic ketoacidosis 6 months after a COVID diagnosis. The research came out in, I want to say, the early fall and maybe late summer, early fall of 2021, that COVID in some people, it literally changes the DNA and the signaling of our pancreas. Not everybody gets this, but some people. So it's almost like a predisposition. And there are actually 2 kind of genetic predispositions that they have kind of zeroed in on as well. That might be a factor. So that the virus does turn on and change the DNA of the pancreas. So it is totally something that happens. Totally random. Even in asymptomatic cases, we're seeing that. Let's see, Miss Alicia, where did you get the email to get your checklist? There's a link down below. So on YouTube, if you are watching live, I'm going to post the link for the checklist. So I'll post all the links here for all of you. But in the replay, all of the details I include in the description box, so you can be able to access that. So I try to be as transparent as I can. And so I'm going to post the checklist now. Is linked down below. And then I'll also post the protocol. So the protocol drives you right on. And I actually have a free guide too that you guys might want to look. They're free. I'm going to list this so you know the difference in the comments. So for all of you live in the chat, you'll see it on the chat, but just know that the description box, and for Facebook, it'll be up there. For YouTube, it'll be down there. And make sure you hit the heart, follow, like That really actually helps support my channel. So if you love my content, make sure you share it. There's this whole engagement thing that YouTube helps promote us. And so I really value that if you help support me. Let's see, says Betty, as many times that I've gotten the virus, what do you about getting the vaccine? So that's something that I really feel like this is helpful. You want to make sure you're not overly inflamed before you get the vaccine. Or in some cases, it can be slightly triggering because there's that immune response. So it kind of depends on each person. That's where working with a clinician can be really, really impactful. Yeah. And so Angela, fatigue hits me every day at 2:30 p.m. and I'm almost useless until bedtime. So one of the things that can be there, and this is, I personally experienced with when I had Epstein-Barr. And if you are dealing with that kind of reactivation, what happens is like the act of eating lunch is overwhelmingly exhausting the process of energy to digest your food. So and that's why I'm digging into this month's workshop is digestion oriented. This is going to be next month's workshop. Actually, yeah. So next month is like in 2 days. So March's private workshop is $24.99. I'll post this week where you can gain access to that. I'm going to be digging into like, what does that look like in terms of the whole digestive process? And so fatigue can be coming from, after lunch fatigue and it can also be triggered by low cortisol. So you may be having this kind of cortisol up and down effect. And I do testing. So if you're interested, check out my website for all that information. So Kit has asked us, as far as far infrared, the light therapy things like the chiropractic clinics offer. So that's a good question. So there are like those little light therapy units that people, you see like the little square and people sit in front of them. The research has been over the whole body. And sometimes even research is inside like specifically designated internal type of far infrared. Some clinics offer it. Some spas do as well. You just have to Google in your area. So Kit, what about colloidal silver nebulizer for lungs? I have found, it's one of those things I can't prescribe, but I know a lot of folks that are doing that. Colloidal silver is a really good antimicrobial, antiviral. But if we're dealing with lung scarring, so there's an aspect where like, are we dealing with an active infection? Meaning, are we dealing with pneumonia? In that case, that's highly beneficial. And you'd want to hit it kind of in the beginning. But if we're dealing with inflammation, it's not really the solution. And so that's why I really dug into some content here. And Kit shared this to Christian Forum. Thank you. I appreciate you. On the fringe, let's see, says, I'm experiencing hip pain out of the blue. Is that a long COVID symptom also? Thank you, Bonnie. Hey, Bonnie, I hope you're having a good Sunday. I need to take a quick little hydration break. I talk a lot, I talk fast, so I apologize. There's so much information I want to share with you. And I want to thank each of you for spending your Sunday with me today. So the hip pain, yes, pain can be. We can experience joint-related pain. So it could very well be some ligament-related inflammation, and that is something that can be a factor. So it's one of those things. Hips can be really tough because it's hard to tell. Is it inside? Is it like labrum related? Is it a tendon or a ligament? But definitely, for sure, we will see an assortment of organ-related challenges. So let me kind of get rid of that comment. So going back to like all of the different body systems that get impacted are going to be listed here, but there's also a net inflammatory effect. And so that is where we see a lot of folks that will be dealing with systemic inflammation that's going to affect your muscle. So if you are already dealing with an autoimmune disorder, like fibromyalgia or lupus, you're going to flare. And you might be actively now having they're not co-infections, but kind of, what do we call it? Like, I'm sorry, it's a Sunday and I'm trying to think of what we call this, but like tertiary related conditions. So, secondary and tertiary related conditions where those are getting exacerbated or triggered. So again, like that re-engagement of Epstein-Barr, a triggering of a lupus flare, or even folks that are in remission with MS. We're seeing folks getting out of remission with that. So that's really, really, really powerful. So I hope that's helpful, Bonnie. So Taylor, what I would recommend, I have very specific supplements in my long COVID protocol, and I have it listed down in the comments, down in the description box below, Facebook up there. Download that, or actually what you'll do is you'll sign up for my full script store and you'll see access to that. Okay, so let's see, Carlene. Here we are. Hey, Carlene, definitely interested in fasting for women, also fasting when having low cortisol levels from long-term stress adrenals. Thanks for all your sharing. You're welcome. Let's see. So Kit, you've got a lot of questions. I will probably utilize some of those questions in future content. And I so appreciate this comment. I might have to screen grab that. That is very sweet for you saying that. So she says, you are my new favorite. I love that you take time to interact and acknowledge questions and comments. Thank you. You're welcome. I am grateful. I love going live with you guys. I feel like it's been a while. It's been a little chaotic. 2021 for us was crazy. We kicked off the year last year redoing our kitchen that had a flood the year before. That was supposed to be a 3.5, 4 week process. It was 6 months. And in the meantime, Brian got a new job and we ended up relocating. I had to sell our house. He moved before we did. Then it was a crazy market. We didn't buy a house until like the end of September, moved in here like early October, and then found mold in our house. It's a mid 90s house. And so it's been just chaos. And so I'm back to final normalcy, and you'll be seeing a lot of me, Kit. So I appreciate you. Okay, so Angela, hello. I am 54 and I'm going through menopause. My friend keeps telling me that the symptoms are menopause related instead of long haul. So this is what I tell all my patients: trust your gut. You know your body better than anybody, and it's not uncommon for there to be both menopausal symptoms that are getting exacerbated by long COVID. The other thing that I feel like is another follow-up video is the stress effect from an infection like COVID. And there is a net I call it the tidal wave effect, but basically we have stress that came from the body fighting an infection, whether it's asymptomatic or we are on a ventilator. There's these poles of experiences. The body has gone through a lot. And so, Angela, it's not uncommon that some of the inflammatory condition, the inflammatory impact, the cytokine reaction, is also going to affect the liver. That affects the thyroid. That affects our hormone regulation. And so there are deep connections to all of it. Trust your gut. And, for friends that are not clinicians, they're well-intended, but they don't know. And so that's my advice there. I hope that's kind. I'm not trying to be mean to friends, because they, I think, are trying to be helpful. But honestly, your body better than anybody else, and advocate for yourself is always what I'm pushing. You know best. And if your gut is telling you that it's that, trust it. That's our intuitive instinct. Okay, Miss Alicia, thank you for the checklist. You're welcome. So if you're new joining, this is a free checklist. I list out tests to run for long COVID, and there are really specific information there. And so Kit's dealing with a lot. I'm so sorry. And she said, for me, these are brought on by long-term trauma. Trauma is stress, and stress can trigger all sorts of things. And so going back to stress and COVID, I'm not surprised. And flaring is so common. Okay. And MZ, hey, MZ. Hello, doctor. Your views on dandelion root as a supplement. I love it. So for all of you who regularly watch me, I drink dandelion all the time, and I'm recommending it all the time because it's so good for liver function. It helps support the metabolic process of the liver. It helps enhance the liver's process of thyroid hormones. It helps the liver produce bile, which eliminates toxic chemicals and excess hormones like estrogen, and it'll get bowels moving. I love it. I think everybody should be drinking it. That's my view. Usually I have it on my desk. I have my water and my mineral water. So it looks like we're at the end of our questions. So I'm so grateful for all of you joining. Make sure, if you have not watched or watched my COVID playlist, I have a COVID, and I have a long COVID playlist. Watch this video. That's going to be helpful. Make sure you download my protocol via Fullscript, and that is accessible in links down below. I also have links in the chat box. And looks like we have one more comment. Let's see, let me get down to the bottom. Oh, MZ said, thanks. You're welcome. You're also, thanks. You're welcome. Okay. So the other thing, just know this week, I will be sharing with you a link for you to participate in, join my workshop. These are paid workshops I do monthly. The Healthy Gut, Happier You is going to really dig into gut healing. I will have a segment in this workshop for long COVID and COVID patients. So if you are dealing with digestive imbalances, if you are dealing with IBS or SIBO or leaky gut, this is really, really going to be powerful and impactful at helping you really recalibrate your gut microbiome, and really, really helpful. Susan. Hi, Susan. It's good to see you. She says, good afternoon. You look so nice today. That's so nice. I always tell Gabriel to tell people to be kind and to appreciate people. And so we are big words of affirmation fans here in our household. So thank you. My hair is so long. Yeah. So my hair is really long. Like it's crazy long. I don't know if you can see it. Like I am due for a cut. We have I'll tell you, we have our third and final wedding date coming up in 3 weeks. So I am due for a little trim to kind of clean up things. And I might be doing a little natural dye because I'm having some grays coming in. And I actually have a video on that too. So, but thanks for saying that. I straightened my hair the other day. And so I have curly hair. And so when it goes straight, but yeah, I've been doing a lot since we've moved in and kind of got stable. I'm back on healthy, super, super healthy nutrition and juicing and doing all my smoothies and stuff like that. That was challenging. Okay, MZ, one more question. Doctor, please educate us about treating gallbladder stones. Yes, I will do that in another video. I promise. I have a ton of video content. They're like posties actually all over my office of video ideas. So I am expanding here and getting some help so I can produce more content with you guys or for you guys. All right, Shayna 52. Hello, I have a question. Can you take too much probiotics? So that is an excellent question for the workshop that I'll be posting, but there are good probiotics and there are not so good probiotics, and there are different forms. I actually have a probiotic video that came out recently on YouTube, and it's a top 5. I'm going to send the link here in the description box below. So there you go. So the link, Sheena, look in that chat box. I have it on like 5 really key probiotics for women. So check that out because that highlights some wonderful resources for women. The probiotics are basically bacteria strains and types, and then versions of certain bacteria. And they each support different systems like our skin and our vaginal health and our lung health and our oral health. And so they, it's not just like one type that is what we need. And so I highlight a little bit more about the nuances of probiotics with women and women's health. I think that might be helpful. Mary, I think that's Mary. Hey, Mary. Let's see. Had a positive ANA test after COVID, totally common. Positive COVID, HAN11. We'll see a rheumatologist next. Chest is great. Negative C reactive protein. Not sure. Chest x-ray, but still coughing, chest pain. Yes. So likelihood you might be dealing also with some scarring. So we're seeing a lot of, especially if there was, depending. So the lungs of a vaccinated versus unvaccinated post-COVID, long COVID are varied. The degree of inflammation can be the same or slightly lower. Generally, what we also see is scarring can be a factor for any of those individuals. So the other thing is, so the scarring is something that I address in some of the more specific protocols that I've posted here. And it's, in January. Okay. So scarring could definitely be a factor. What I have found is that folks that have natural tendencies to weaker respiratory health So let's say you have asthma or have had a lot of bronchitis or previous pneumonia infections or have kind of upper respiratory, lower respiratory distress, folks that have smoked in the past, or even folks that have been, especially my female patients that have had radiation over their breast tissue, the lungs are radiated. That is a variable that's at play. And then, the ACE receptivity, and I'll go back to this one sheet because it really helps us understand like why all these body systems have gotten activated or not activated, are involved in the long COVID state because the ACE receptivity. And so the ACE2 receptivity is present in all of these organs, from our lungs to our brain, to our spleens, our kidneys, the gastro, and even our vascular channel. That's why folks are having darn amputations, even after the fact, because of the microclotting and the vascular impairment, and why folks are having strokes with mild cases. And so, there's pre-existing conditions that get exacerbated. And so that is a factor as well. So I hope that's helpful. And I'm so grateful for all of you joining today. It has been a pleasure being live. This is available for replay in all these formats, Facebook and YouTube. I am going to have my team kind of splice and dice some of it, and it will also post to Instagram stories and other formats. But I am really excited to have all of you join me today. Make sure you look out for March's private workshop. It's our Healthy Gut, Happier You. It's $24.99. I dig into gut health, and definitely shoot comments, in the video box when this gets all wrapped up. And YouTube, it takes a little bit of time to translate this video, especially we've been an hour and 20 minutes, but you'll be able to gain access to watch this video over again. If you missed, you came in at the beginning, same thing on Facebook, you can replay. Replays will be out there. But feel free to use the comment box. That's a great communication tool. And I'm also building some team members that are going to help me manage and monitor my comments. So I love the engagement. Please hit the like, hit the follow, and I'd love it for you to share this content, especially if any of you are in any of the COVID long haulers groups or any of the Facebook groups. I am grateful. So definitely hitting that like button helps support me. It helps get the word out to more people. And I always value that. And also for any of you who are Amazon users, the other thing that I've started doing is shows on Amazon. And so if you are on Amazon, you can follow. I have an Amazon store. It's not technically a store, but it's all sorts of lists that I've always referenced and highlighted in videos. So if you're like, oh, I want some help on some other, things like what fitness products I use and things that, my favorite cookbooks and stuff like that, you can follow me on Amazon. And so I do some lives there, which is now like a new thing, which is exciting. So and just search natural health resources and you'll find my store and hit the follow button. So I'm grateful. Thanks everybody for tuning in. I am excited. Our next video here on YouTube is going to be about how to alleviate tinnitus or ringing in your ear. This is a hot topic for a lot of long haulers. They're having some of the kind of inflammatory eustachian tube inflammatory challenges. And so I'm going to dig into really how to address that, even for folks that haven't had long COVID. So thanks everybody. Have a great day. I'm so grateful. And make sure you hit the like, hit the share, follow if you haven't, and check out all these free resources and downloads and grab the latest resource here, our long COVID testing checklist, where you can actually take this, print it out, take it to your clinician. All right. Thanks, everybody. I will see you on my next video. And again, I'm grateful. Happy Sunday.